Welcome back to Curious Conversations. Today, we have a very special interview with two guests, Nealie Ngo and Dr. Andre Martin. Hi guys, how are you doing?
Good.
Good, how are you?
Doing great. So before we dive into your new case study, let's go ahead and learn a little bit about your backgrounds. So Nealie, we'll start with you and then we'll go to Dr. Martin.
Yeah, hi guys, it's great to be here. So my name's Nealie. I'm currently a fourth year medical student at the University of Toledo. I'm applying into psychiatry right now and I'm really excited to just kind of share this space with you all and talk about our paper.
Thank you for having us both. I'm Dr. Andrés Martin, and I'm a professor at the Yale Child Study Center in New Haven, Connecticut. And my day job is as a child psychiatrist, child and adolescent psychiatrist, but I'm also very involved in medical education.
Fantastic. Well, it's so great to have both of you on here today. So we're going to be talking about a really interesting and personal article co-authored by both of you. And the title of this article is Pneumatic Retinopexy, Confronting Ocular Disease with Visual Art. So the series is based on the idea of a new trend of physicians reporting on their own medical afflictions. What drew you really to this subject?
I think it was pretty serendipitous actually. It actually all started with a phone call that I got from Dr. Martin. And I remember getting an email first about from him saying to like please call me, and at first I thought I was in trouble. I think it comes from being a student and being, oh no, what did I do now? But yeah, I think serendipitous would be the word that I would use to describe it. We talked and he had like a preposition for me, and it kind of started with him knowing that I had kind of an art background. I'm an artist, and a lot of my work that I've done before is with like comics and graphic novels. And I'll kind of let him talk about how that call went. But yeah, I think serendipitous would be how I would phrase it.
Yes, I I remember it was in January. I called Nealie in a panic. You couldn't tell the panic from the email, but I was in a real panic because earlier that day I had been diagnosed with a pretty serious retinal detachment. And I learned a whole lot about retinas very quickly. But the gist of it is that the treatment that these genius, miraculous ophthalmologists, retinologists, bless their hearts, the crux of it is that they injected an air bubble into my eye to gently put the retina back in place. And when they did that, I started seeing things that you would never otherwise see. And I couldn't quite process everything that I was seeing. It was a different kind of visual overload that I could not express with words or even with my bad images. But I remembered having met Nealie, and I thought she might be able to translate these images. And boy, did she do that. Nealie, what happened next?
Yeah. So I remember getting the phone call and then being both relieved that I wasn't in trouble, but also confused. Because I remember him describing to me what he was seeing, and I was like, bubbles. Okay. I understand. Okay. Like literal bubbles. And then he would talk more about what he saw, and then he sent me his own drawings, kind of trying to capture what he was seeing after his surgery. And it was a really interesting, I think, like first couple of days, because I think both of us were trying to navigate the space of how do we, like, am I doing this right? What does this even look like? What are we trying to do with all this? I remember feeling like really honored that he thought to call me and to kind of, I think, reflecting on it now, kind of invite me on this journey. But I remember in the moment being very confused because I didn't really do a lot of more kind of like abstract things. I did a lot of very like concrete, like, here's a storyline, here's like a comic that goes with it. And so I really struggled in the first couple of days to really listen, I think, to what he was seeing and what perhaps he wanted. But I think that became easier over time. And that became kind of a big thing that I'm very grateful for with this entire experience, is just learning how to listen. So that's kind of how it all started.
So I was going to say, now that we got like this wonderful lead in, let's go ahead and dive right into the case study. So what happened next?
Yeah, I thought that one way to do it is that we should show a little bit of what we're talking about. The first images that Nealie came up with are the only ones that are abstract. They don't really depict what I was seeing or what the ophthalmologist was seeing, but maybe, oops, sorry, not that one, but a combination. So this is, I guess, retinal landscape being shattered in some way, but it's not really a retinal picture. Although it has elements, the green, the evil green color. We talked a lot about evil green color and these jagged edges. It's a representation of what we both saw, but again, it's not literal. It started getting literal in what Nealie was describing. This is one example. I was patched completely on both eyes because otherwise I was very disoriented. But with what little light came through, I could start seeing the bubble. And I jotted this down, me and my bubbles, January 13th. This is what I was seeing. And you see what Nealie did with that. And that's what we got started. And in the beginning, I was just in the dark, quite literally, very anxious about going blind, even though I was assured that that was not going to happen. That was not in the cards. And just very anxious, very, very anxious. The anxiety morphed into something else later on. But Nealie?
Yeah. So like Dr. Martin said, the first things that I ended up drawing were what you see here. He would send me like a sketch. And I think in total, he sent like 15, I think, to me over the course of like months. And I would basically take these sketches and redraw them and kind of reinterpret them in a sense. And so I started all of them with just like a base like outline, just using like thick black lines, trying to kind of reimagine what he saw. And the first picture that he showed actually was probably one of the last ones that I completed, because like Dr. Martin said, like I don't do a lot of abstract work. And so like very concrete instructions, I was able to kind of understand and know what he wanted. But things that were like the very first kind of picture you guys saw was more like emotive. Like a lot of the kind of themes in that first picture were, like I think we use a word like foreboding, like kind of dread, like evil. And in the colors that you kind of see, we talked a lot about that green, and we kind of likened it to that kind of villainous green that you see in a lot of like movies or like are talked about in like literature. We wanted to kind of give people a sense of like what it really felt like that feeling of almost hopelessness, and that green encroaching on this kind of string of lights that you see, this feeling of helplessness when you see it, but it being abstract enough that you could kind of look at it and interpret it however the way you wanted, but we wanted that kind of motion to be there. And like Dr. Martin said, in these kind of next series of pictures, it kind of evolved from this feeling of dread and like hopelessness to kind of like what is this? What am I seeing? Not necessarily wonder, but awe, I think, or kind of like shock of just like, what am I seeing? And Dr. Martin and us kind of doing this together, we talked a lot about just one of the things that stick out to my mind is for a long time, for almost his entire life, he's had trouble seeing very clearly. And these bubbles were the one thing that he could see in the utmost clarity. And myself wearing glasses and also not having great eyesight, like I remember thinking like, what must that be like? And so in drawing these bubbles, I really wanted to kind of get across this like sense of like clarity and like, this is the most concrete thing right now in this moment. How do I represent that as an artist?
But lest you think that it's all the villainous green, there were the warm colors that came through as the patches started coming off. I still had patches, but more light could come through. And that light, seeing the sun through closed eyelids, was like this incredible, refreshing, beautiful thing, refracted through these bubbles. So we went from, or Nealie went from those contours to these really rich, colorful, beautiful images that really show how the bubbles progressed over time. The reddish colors are when I was looking through closed eyelids at a light source. The black ones were where I was in the dark. The white ones could be very powerful when I was, for example, in the shower looking at a white wall. So depending on what I was looking at through closed eyes, I was seeing this. And Nealie, you just nailed it, because this is what I was seeing. This is what I was seeing.
Well, these are
Yeah.
beautiful and like poignant images. So, how did this art therapy journey, and I know there's more to it, so I'll let you finish, but how did it impact you, Dr. Martin, as the patient, and you, Nealie, as the artist?
That's an excellent question. I think it kind of gets to the crux of like what we learned from this experience, because I never went into this thinking of this as like an assignment per se. I kind of went into this being like, oh, a person that is like very important to me wants to do art. I don't know. I never thought of it as like a very formal thing, but I think as we worked on these together, because this started in January, like Dr. Martin said, and we didn't finish until I want to say like the end of the summer almost. It was like a very long multi-month journey. And I think, as an artist, like I would have to put it down at a couple points and then take it back up. Like it was never like I worked on it every single day. I got to take breaks from it. I got to revisit it. And every time I kind of came back to it, I kind of saw something new with fresh eyes. And so I think as an artist, like I never, the words like art therapy never came to my mind as I was doing it. I think in the beginning, I was very focused on how do I make sure that I represent what he's seeing. But through our conversations and just, we would text each other, we would send voice messages, we would like have formal meetings over Zoom, we would email each other, all of these things. Like I got a sense of who he was as a person, and I got a better sense of how he was doing, just like day to day, week to week. And just kind of like for me, like doing this with him was a way that I connected with him. And I think in a way that's like not your typical, like, I guess, like mentor-mentee relationship, but it also gave me a better sense of just how art is a way for people to process. Because even though like I produced these images, Dr. Martin also sketched the initial images that you saw. And working with him to kind of refine like, oh, is this what you saw? What should I edit? What should I change? Doing these kind of small changes. He was also able to be an artist in that sense, kind of like a conduit through me. And I think that was something very powerful too, because not only was he sharing what he was seeing, kind of, we talk in the paper about how it went from him going through this process kind of alone to like he was able to share it with me and with art, which was a way that was more approachable and I think less scary, because he went through a very kind of major medical experience, that it allowed him to kind of process it in a way, at least to me, this is what it kind of felt like, in a way that was helpful and different, I think, in like a more traditional way. But yeah, what do you think, Dr. Martin?
Well, looking at this image, one of the things that comes to mind is that Nealie, through her, not just her artistry, but through her persona and through who she is, helped me put into little boxes, quite literally, something that was extremely frightening. And there were two frightening things going on at the same time. One was the eye situation, and I'm glad to tell you that everything worked out and I'm doing very well. But also, it wasn't obvious to Nealie and I at the time, but I was also in the psychiatric department not doing so well at the time. And these two things started bouncing back and forth at each other. And I'm just going to leave it at that. And I encourage our viewers to read a paper in Cureus that I wrote earlier this year, about that psychiatric situation, when a psychiatrist is afflicted with a psychiatric condition. But anyway, Nealie helped put things into a box. And the other thing that I will say, going to the next image, we call this image all clear, because this is as the bubble started coalescing into just one single bubble. And eventually it disappeared. But it didn't disappear completely. I mean, it disappeared completely, but it's not like my eyesight doesn't see all sorts of floaters and big floaters and all sorts of strange things, which is the lower right quadrant. But But I would say that Nealie helped things get to the all clear. She was my psychiatric ophthalmologist or my ophthalmic psychiatrist or my artistic ophthalmo-pneumopexiologist. I don't know what she was, but she was great. And she's going off to psychiatry school. If you can imagine that, she's going to her residency. So I'm just thrilled, and I'm very proud to be Nealie Ngo's patient, probably number one, psychiatric patient number one, or number two, number three. I'm in the low numbers. So thank you, Nealie.
Of course. And I feel like it's so hard because it was such a special experience. I've been able to kind of talk about it actually in some of my interviews, and I don't know how to kind of say this, but it was, I don't know, to be a part of someone's experience, I think is a very special thing that, not only as like a future physician, like I will have that opportunity more in patients' lives, but just to kind of see like the everyday of it. Like I talk about how there was at some point where we talked to each other almost every day. Either we texted or voice messaged or called, and either to kind of talk about the bubbles or to talk about inspirations for the bubbles. During this time, I lived in New York City, and I remember when we were getting to like the coloring part and adding color to it, I was feeling very stuck because I was, again, like, this is not really the kind of artwork that I'm familiar with. And I remember going to the Guggenheim and trying to find inspiration about how I could bring together what he was seeing and how he was also feeling. Like the project went from, not only what was he feeling, but also like, what did I kind of like get a sense of how he was feeling coming through all the communication he sent. Like the bubbles were not just visual, there was an emotion part to it. And I remember I went to an exhibition by Kandinsky that was at the Guggenheim at the time. And I remember sending him all these pictures because a lot of his work evolved like spheres and like circles, but were also emotive in the sense of what I was trying to do, but I couldn't quite get at. And I remember we were both freaking out about these pictures because we were like, oh my gosh, like this, like maybe this part of this picture is what really clicked, or like he really liked this aspect of it. And I would come home and I would kind of play around with things to see how I could like bring those features into like the artwork, but also make sure that it was still his, and that I wasn't, just kind of trying to copy another artist. So it was really interesting because I've never done any of this before. And, this journey was not just like an artistic one, but it was also one in which, I really, at the end of it, well, as I reflect, kind of got a sense of how to sit with people, like how to listen. And I feel like that's something that is not taught a lot in medical school, how to just be with people and share that space with them and be a part of what they're going through. And again, that's not anything that I recognize in the moment, but like Dr. Martin said, as we're kind of reflecting on this months after we've published this paper and worked on all this stuff, that's kind of like some of the things that I've thought a lot about. And I'm, again, very grateful that I've had the opportunity to be a part of it. So thank you, Dr. Martin.
So in hindsight, this seems like a wonderfully transformative experience for both of you, as you, Dr. Martin, say that you're finally like at the end of the road to recovery, and you, Nealie, are like going to residency. So yeah, it's an immensely powerful and personal journey, at least from my point of view. So thank you so much for sharing this. I have to ask though, even though this was such a personal journey, do you see that this kind of art therapy could be used as a treatment for certain types of ophthalmological like disorders or different types of disorders? Like, what do you see as the implications of this case study?
I won't opine on that because Nealie has only so many hours in the world. I would want her and the other Nealies in the world to do that. But I think I want to make a broader point, which is whether it's painting, cartooning, any form of artwork as it intersects into medicine, I think is a win. And the other thing, and we know this, I'm not saying anything that is so, shockingly novel, but we tend to forget that. But what is shockingly novel, and I do want to thank Cureus and give a shout out, is that journals that publish the lived experience of physicians I don't know somewhere else that does that. And I'm very grateful for that opportunity, for that space. As you see, I've done it now twice, one talking about my psyche and one talking about my ophtho. So, so thank you. That is my dog making noise.
Yeah, that's totally fine. We'll wait for him to come back. Oh, yeah.
The life of a doctor, you know, it never stops.
Yep. So yeah, so given this, what work do you both have planned for the future? Nealie, are you going to continue like working at this intersection of art and medicine?
Yeah, that's a great question. And very poignant because I, like Dr. Martin said, I'm in the middle of like residency interviews. So this is quite a question I get asked quite often. But yeah, I'm really fascinated by this. I feel like a lot of my kind of academic interests have been at the intersection of art and medicine. My college major was the history of science, medicine, and public health. So very much humanities meets medicine and public health. And throughout medical school, I've been really lucky to be able to join a lot of projects that allow me to kind of bring my skills as an artist, but also as a future physician. So I absolutely am really interested in how we can use art. I think in different ways. So I think art as a form of education through, comics, graphic novels, is a field that I'm really interested in, and using, like qualitative data analysis, like community outreach to kind of see how that would work. But also finding ways to bring art more into the clinical space. There's been a lot of stuff published about like art therapy, visual literacy, like taking medical trainees to art museums and kind of using that as a way to train their eye. Because I think it's very hard to look at outcomes, which is what a lot of, kind of journals and things that they would want to kind of see solid numbers. But I think art has such a huge potential for medicine, like Dr. Martin said. There's something beautiful about art because it brings humanity back into the picture. Not to say that medicine lacks that, but medicine can be very, it can be very kind of cold. It can be very objective in ways that a lot of patients, they want that kind of touch of humanity that I think all of us would want as patients. And I think art brings that in a way that is very natural, because people respond to art differently and whatnot. So it's definitely something I'm really interested in pursuing as in residency and beyond.
Wonderful. And I guess we'll end off with a final question. What advice do you have for budding researchers or budding people who want to combine art and medicine in your case? What advice do you have for these people?
Oh my gosh. Okay. I think honestly, everyone is an artist. I don't think you need any type of training. You don't have to be good at it. I think art is more important because of the way it makes you feel and the way that it helps you process things. And so I feel like if you're interested in exploring the space, seeing what you like as an artist, whether that's playing music or drawing or reading, honestly, or writing, I think any of those are great ways to kind of start, but also finding places that would foster that kind of growth, I think is really important. So Cureus is a good journal. The AMA Journal of Ethics does a lot of like medical humanities work, and they're very friendly to like medical students. So I think finding places where you will feel supported and not being afraid to try out what you like, I think are both great ways to start. And that I think because a lot of medical trainees are perfectionists, me included, to not be so hard on yourself and, do what makes you happy. And that's kind of how I've gotten to where I am.
Let me just add something slightly different, not contrarian, but I disagree with one thing that Nealie said. I don't think that we're all great artists. I don't think that I can, play the cello or draw like you do. And, there are a million examples. So I think two things. For those of you like Nealie who are artists and who have a talent, I would say that there is a place in the big house of medicine to include this. It might take a while to figure it out, but there is that. And in addition to journals and whatnot, I think that mentors are really important. People who understand and who value the importance of this. And for those of us who don't have a talent, and I mean, I just don't, but I appreciate art. And I certainly appreciate those of you who have those gifts and how to bring that forth, right? So there's a lot in the House of Medicine for art, and I think we all need each other. Those of you who are the real artists, and those of us who are the consumers of art, and we need to humanize medicine. We know that.
What a lovely call to action that was. I love that. Well, thank you so much for joining us today and sharing these beautiful images with us. It was really touching to hear your journey, Dr. Martin and Nealie. So thank you so much for joining us on this episode of Curious Conversations.